Hello and welcome to a new episode of Science in Context. I'm Ryan and this week I'm joined by Dr Sabine van Elsland to speak about the policy impact of the Imperial COVID-19 Response team. Hi Sabine, so can you tell us a little bit about this team and the impact that they work out?
Thank you so much, Ryan. So from the very beginning of the COVID-19 outbreak back in January 2020, 5 years ago, the team provided continuous, robust, real-time epidemiological analysis to inform policy decisions of governments and global health agencies. And they build on existing global health partnerships and experience from previous infectious disease outbreaks from the MRC Center, which is a WHO collaborating center.
And what does your latest paper tell us about the impact that their work had?
So what we looked at was all the outputs this team produced in the first 2 years of the pandemic, including reports, preprints, journal articles, alongside the news items that report on that. And then we looked at all the policy documents that cited that work globally. And what we found was that almost half of these outputs were cited in policy documents. All types of outputs were cited in policy documents, including news items. And journal articles were cited most, but had the longest delay between being published and being cited. Reports and preprints were published much faster and had a shorter delay between being published and being cited, so making them critical in a timely response.
So how might this type of analysis help us in future outbreaks?
So research is important, especially during outbreaks, and policy is critical. And what we see from this work is that different ways of communicating that scientific evidence, such as news items or videos like this, are really important in addition to more traditional outputs in making research and scientific evidence from that research more accessible and effective in reaching policy decision makers. Now, another thing I take from this work is that in addition to scientific journal publications, this particular work to inform policy decision making needs to be recognized.
Sabine, thank you so much for your time.
Thank you.